Good evening, friends. Today we are going to discuss about endocrine system for the who are going to write the pharmacist grade 2 exam and also as well as nursing exam. The first question: which endocrine gland is responsible for the regulating metabolism and energy production in the body? Option A: thyroid gland. Option B: adrenal gland. Option C: pancreas. Option D: pituitary gland. The answer is the thyroid gland. The thyroid gland is responsible for regulating metabolism and energy production in the body. So let us discuss about the remaining options: adrenal gland, pancreas, and pituitary gland. Here you can see the adrenal gland for regulating the stress response, and also it releases the sex hormones and it's regulating the blood pressure also, and also as well as the pancreas for maintaining the healthy blood sugar levels in the blood. It releases the hormones like insulin and glucagon. And insulin decreases the sugar levels in the blood and glucagon increases the sugar levels in the blood. And next, pituitary gland. Pituitary gland is responsible for the growth, metabolism, reproduction, stress response, lactation, and temperature control and pain relief. So here, which endocrine gland is responsible for regulating metabolism and energy production in the body? Is thyroid gland. And going to the second question: which hormone is produced by the pancreas and regulates blood sugar levels by promoting the uptake of glucose by cells? Option A: insulin. Option B: glucagon. Option C: cortisol. Option D: aldosterone. The answer is the insulin. The insulin hormone is produced by the pancreas and regulates blood sugar levels by promoting the uptake of glucose by cells. So let us discuss about the remaining choices, options. B, glucagon. So you can see here the glucagon is the causes release the stored sugar from the liver into the blood, so it increases the blood glucose levels. And also going to the cortisol, the body stress response, and aldosterone, it regulates the blood pressure. So the answer is the insulin. The hormone is produced by the pancreas and regulates blood sugar levels by promoting the uptake of glucose by cells. And coming to the third question. The third question: what condition results from an excess of growth hormone in adults? The option A: gigantism. Option B: acromegaly. Option C: dwarfism. Option D: Cushing syndrome. So you can observe the question clearly. What condition results from an excess of growth hormone in adults? So here you can observe the answer is acromegaly. Acromegaly is the answer. And here you can see the remaining options. The acromegaly and gigantism are disorders of the growth hormone hypersecretion. Both are the growth hormone hypersecretion, but you can observe clearly in adults it's called acromegaly, and in childhood it called a gigantism. Gigantism means it increases the overgrowth of the body height, and in adults in acromegaly, it increases the bone masses and soft tissues in hands and feet and head and face, and it is not affect on the height of the body. So you can clearly observe the childhood it called gigantism, in adult acromegaly, the overproduction of the growth hormone. And dwarfism means the short stature or small size, and the low levels of the growth hormone causes the dwarfism. That means short. And also Cushing syndrome. Cushing syndrome means the facial roundness and weight gain around the middle body and upper back. This is called Cushing syndrome, and it caused by due to the hypersecretion of the cortisol hormone. Okay. So here the answer is the what condition results from an excess of growth hormone in adults means the answer is acromegaly. In childhood gigantism. Okay, the dwarfism means the lower secretion of the growth hormone. Okay na, the Cushing syndrome means the overproduction of the cortisol. Okay. uh, and question number 4, which hormone is responsible regulating calcium levels in the blood? So option A prolactin, option B parathyroid hormone, option C insulin, option D thyroxine. Our answer is parathyroid hormone. The parathyroid hormone is responsible for the regulating calcium levels in the body. So you can see other options also. The prolactin. So option A prolactin, the responsible for the breast development and lactation. And thyroxine T4, it controls the metabolism and growth. Okay. And insulin, it controls the uh, sugar levels in the blood. Okay. So here the which hormone is responsible regulating calcium levels in the blood is the parathyroid hormone is responsible for the regulating calcium levels in the blood. Okay. And coming to the question number 5, and which hormone is responsible for promoting water reabsorption in the kidneys and increasing blood pressure? So the options are the aldosterone, option A aldosterone, option B cortisol, option C thyroxine T4, option D epinephrine. So our answer is aldosterone. Aldosterone is a hormone is responsible for promoting the water reabsorption in the kidneys and increasing blood pressure. Okay. And discuss about the remaining options like cortisol, it causes the Cushing syndrome, and also it's responsible for the stress. Okay. And thyroxine, it is the thyroid hormone responsible for the growth and body metabolism. And coming to the D epinephrine is the responsible for the fight or flight response. Okay. And coming to the question number 6, and which which endocrine disorder is characterized by high levels of glucose in the blood due to inadequate insulin production or utilization? Option A hyperthyroidism, option B hypothyroidism, option C diabetes mellitus, option D Cushing syndrome. The, the which endocrine disorder is characterized by high levels of glucose means diabetes mellitus. The answer is diabetes mellitus. So coming to the next, what is mean by hyperthyroidism? Means overproduction of the thyroid hormone. It leads to the weight loss and severe headache and fatigue and irregular menstruation, uh, etc. And hypothyroidism means the low levels of the thyroid hormone production by the thyroid gland, and it leads to the overweight and also hair loss. And next, coming to the Cushing syndrome. Cushing syndrome is the overproduction of the cortisol hormone, and the symptoms are the overweight in the abdomen, and also backside, and also the round face, like a puffy face. So this is the Cushing syndrome due to the high production of the cortisol hormone by the adrenal gland. Okay. And coming to the question number 7, the what is the primary function of the adrenal medulla? Option A regulation of metabolism, option B regulation of blood pressure, option C production of sex hormones, option D release of stress hormone. The answer is release of stress hormone. And coming to the option A, regulation of the metabolism is by the thyroid gland, and regulation of the blood pressure, and production of the sex hormone by the adrenal cortex. So here you can observe the adrenal medulla. Adrenal medulla is the primary function is release of the stress hormones. Okay, and coming to the eighth question, which hormone is responsible for stimulating milk production in the mammary glands? Option A, prolactin. Option B, oxytocin. Option C, estrogen. Option D, progesterone. The answer is option A, prolactin. Prolactin is a hormone is responsible for stimulating milk production in the mammary gland. And coming to the next options, oxytocin. The function of the oxytocin is the stimulates uterine contractions during labor and childbirth, and breast tissue contraction to aid in a lactation. Okay, and coming to the estrogen. Estrogen development of female secondary sex characteristics like breast and pubic and armpit hair, growth of the armpit hair. And coming to the progesterone, prepare the endometrium for a fertilized egg to implant and grow. So these are the functions of the oxytocin, estrogen, and progesterone. The prolactin is a hormone is responsible for stimulating milk production in the mammary gland. And coming to the question number 9, the what condition is caused by the insufficient production of antidiuretic hormone ADH, leading to excessive urination and thirst? And option A, the addition disease. Option B, Cushing syndrome. Option C, diabetes insipidus. Option D, hyperthyroidism. Our answer is option C, diabetes insipidus. The diabetes insipidus is caused by insufficient production of antidiuretic hormone ADH, leading to excessive urination and thirst. So coming to the next remaining options, see here the Addison's disease. Addison disease. Addison disease means the adrenal glands produce insufficient amount of cortisol hormone. So the cortisol hormone is less production, it causes Addison's disease, and overproduction it causes Cushing's syndrome. Okay, and also next option is hyperthyroidism. Hyperthyroidism means overproduction of the thyroid hormone, and the symptoms are hair loss and weight loss and severe headache. Okay, and also coming to the 10th question, which gland is responsible for producing melatonin, a hormone that regulates sleep wake cycle? Option A, adrenal gland. Option B, thyroid gland. Option C, pineal gland. Option D, pituitary gland. Our answer is pineal gland. Pineal gland is responsible for producing melatonin, a hormone that regulates sleep wake cycle. Coming to the remaining hormones, the adrenal gland. The adrenal gland produces the cortisol and aldosterone, and also androgens and estrogen. Okay, is a, and also adrenal medulla produces epinephrine and norepinephrine hormones. And coming to the thyroid gland, thyroxine T4 and triiodothyronine T3. And coming to the pituitary gland contains the two portions, anterior pituitary gland and posterior pituitary gland. Anterior pituitary gland produces growth hormone, prolactin, adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone, and thyroid stimulating hormone. And coming to the posterior pituitary gland, the posterior pituitary gland produces antidiuretic hormone ADH and oxytocin. And next, coming to the 11th question. The 11th question is, which hormone is responsible for stimulating the growth and development of ovarian follicles in females and sperm production in the males? The option A, luteinizing hormone. Option B, follicle stimulating hormone. Option C, progesterone. Option D, testosterone. Our answer is follicle stimulating hormone, FSH. And coming to the remaining options, and LH, luteinizing hormone, it triggers the ovaries to produce progesterone in women and stimulates the testosterone production in men. And coming to the progesterone, it creates a healthy uterine lining to support a fertilized egg, embryo and fetus. And coming to the 12th question, the which condition is characterized by an overproduction of cortisol by the adrenal glands, often resulting from prolonged exposure to stress? The option A, hypothyroidism. Option B, hyperthyroidism. Option C, Cushing syndrome. Option D, Addison's disease. Our answer is option C, Cushing syndrome. Cushing syndrome is a condition is characterized by overproduction of cortisol by the adrenal gland, often resulting from the prolonged exposure to the stress. And the explain about remaining options, the hypothyroidism. Here, hypothyroidism is decrease the thyroid hormones, and hyperthyroidism means increase or high level of thyroid hormones. And Addison's disease, the adrenal gland produces low levels of cortisol, it leads to the Addison's disease.